Between 1956 and 1961, about 10,000 children were born with missing limbs. Some of them were born completely limbless. It was discovered that this was caused by the use of a drug called thalidomide. That drugs could cause such horrible effects during pregnancy shook up the medical and the pharmaceutical world, and thalidomide was banned from the market. But still today, there is a huge lack of knowledge about medication use during pregnancy. More than half of pregnant women use medication during pregnancy, but 70% of medication that is used is not, the consequences of those medication is not studied in pregnant women. This poses a huge ethical dilemma. Either systematically test new medication in pregnant women, or give untested medication to pregnant women when they really need it. But the thing is, both of these options pose a huge threat to the unborn. Therefore, a major scientific challenge is to identify alternative ways to study medication use in pregnancy. I'm exploring one of these ways, the human placenta. This incredibly complex organ provides the fetus with nutrients, but also protects the fetus from toxic compounds, such as certain medicine. If this protective function gets distorted, the fetus may become more vulnerable for the toxic effects of these medicine. To study this, I use human placental tissue. When a woman gives birth, I collect her placenta and I revive it. For a few hours, I'm able to keep it alive and to mimic the biological placental barrier between mother and child almost exactly and identical to how it's present during the end stage of a real pregnancy. And during these few hours, I can study these protective mechanisms of the placenta. Of course, I need a lot of placentas to study this. But if eventually we have a better understanding of this protective mechanism, we can use it to protect the fetus and circumvent the ethical problems that are posed. And all of this, of course, to in the end prevent horrible and life-determining consequences for those who cannot yet raise their voice.